Good afternoon and welcome to the final keynote session of the Alliance for Health Policies Summit on Health and the Economy. This has been a fascinating 2 days, and we have explored a number of intersections between health and the economy. We've heard from a very diverse array of people from across the political spectrum and from some very new voices for the Alliance, including labor market experts and small business owners who have really hustled to get through this. Of note, mental health has come up on just about every panel so far, and today we are so pleased to focus our final keynote panel on this important topic and learn how one mayor leveraged federal resources to address mental health in her community. You can join today's conversations on Twitter using the hashtag AHPSummit21 and follow us at All Health Policy. We want you to be active participants, so please get your questions ready, and here's how you do it. You can navigate yourself to the chat box on your screen and use this feature to submit questions to the panelists, as well as seek support for any audio or tech issues you might be experiencing. So materials for this event will be located on the left-hand side of your screen under the Agenda tab, and you can select this panel to view details and extended speaker biographies. And now, I am so pleased to introduce Mayor Hillary Schieve for today's keynote discussion to end our Health and the Economy Summit. Mayor Schieve was elected as Reno's mayor on November 4th, 2014, and was sworn in on November 12th, 2014 as the 28th mayor of the city of Reno. Prior to being elected mayor, she was elected as at-large Reno City Council member on November 6th of 2012. Hillary Schieve brings to the council her entrepreneurial expertise as an employer and a local business owner, and she is the owner and operator of 3 businesses in the city of Reno. She's been named one of America's 11 most interesting mayors by Politico magazine, the Reno Gazette Journal's 2011 Entrepreneur of the Year. And on July 23rd, 2020, Mayor Schieve was selected to chair the Reno Sparks Convention and Visitors Authority Board. She is the first woman to chair the organization since 2010. Most recently, she has worked diligently to reform and revitalize downtown Reno and has, in partnership with Reno City Council, formed an Operation Downtown group focused on reimagining and revitalizing the downtown corridor. She was born and raised in Reno, Nevada, and it is only appropriate that we end our summit today with a politically independent mayor to highlight the Alliance's nonpartisan focus. So, Mayor Schieve, such a great pleasure to have you on our panel today.
Oh, thank you, Sarah. It is so wonderful to be here, and I want to thank the Alliance for Health Policy on every level for talking about this issue. It's something that's incredibly near and dear to my heart, so I want to thank all of you and incredible people out there working on policy. It's really, really important, but it's such an important conversation, so I'm super honored to be here. Thank you.
Thank you, and I'm honored to be here. And we're going to be talking a lot about leadership and vulnerable leaderships. I have to start by actually giving you a public apology, which is that I spent most of my life thinking that Nevada was pronounced Nevada. So I was an ignorant East Coaster, and then I got schooled. So thank you for being the mayor of Reno, Nevada.
That's very true. We notice it every time, and we'll call you out. So it's a good thing. You realize.
Yes, I was called out by your insurance commissioner at one point, and thank goodness. So, so here we go. So, so we're going to talk a lot about leadership. We're going to talk about mental health. We're going to talk about your journey. I want to start off by take me to March 16th, 2020. Tell me what that day was like for you, and what was going through your mind that day.
Well, I was telling you I'm not great with dates, and it's certainly a date that I would remember for obviously the rest of my life on so many levels. Like I said, I barely remember my birthday, which is probably by design, but I would say that, Monday, March 16th sort of changed my life in so many ways, 2020. And I think for so many mayors, for me, I was the first city to close down our city. And honestly, it was just something that, I had never imagined being a mayor that I would be doing, obviously, closing it down for the health and safety due to COVID reasons. And decimating, I want everyone to think about this, like what that's like, to be a mayor or a governor, just thinking how you make that decision and how difficult it is, and decimating an economy within, a 10-minute presser. It is something that, I just remember the stress, the fear, and sort of everything that came over me to make that decision, because I really felt in my heart of hearts that we have to do everything possible to keep our community safe. And I think, all of us mayors across the country were watching places like New York and Seattle and thinking, wow, this could be us next, right? So it was a very, very stressful day. I mean, obviously, the entire year was incredibly stressful for many cities. And I'm very close with mayors across the country and work very closely with the Conference of Mayors. And, being on the phone with so many mayors and making decisions like bringing in refrigeration trucks for bodies and things like that. And I watched, their demeanors change dramatically. Remember, mayors are like champions of their cities, and they're the biggest cheerleader of their cities. They're used to, opening businesses and flourishing economy and attracting visitors and things like this. And I think so many mayors had to pivot so quickly and learn about public health infrastructure and learn about all these different ways. Usually as mayors, we're so used to working with our public safety departments, like our fire and our police officers. I mean, never before have we had to reach out to epidemiologists and, public health officials and, people, experts in our community on this type of situation, on a pandemic. And so I think mayors quickly pivoted and learned so much. And I think, in some good ways and in some bad ways. Obviously, I think we'll be better moving forward. But I think there were so many challenges, right up from the federal level, right down to the local level. And we all saw that everyone was sort of on different pages from the federal level to the local level. And that made it incredibly challenging. So I think for mayors, like I said, I call it sort of America in mourning, because so much had changed dramatically. And I think one thing is, we were talking about, and I'm sure many of you heard this, is that we would talk about this first wave of COVID. We would talk about this second wave of COVID. And I started to quickly realize, wait a minute, but the tidal wave is actually going to be the mental health aspects of COVID. And that's whenever I really started to think, much more ahead of like, what does this look like for the future? What does it look like when we come out of COVID? What do we need to be thinking about that is going to make the biggest impacts in our communities? And what I really saw is so many barriers to mental health and access to really great health care. And so I really learned a lot. And, I hope that my experience in some way can help all of you sort of shape the way you make policy and the way that you think. Because mine was very, very non-traditional for many reasons, personal reasons, but also for my entire community as a whole.
Yeah, thank you. And I want to ask you what really led you to mental health. And you mentioned this idea of America in mourning, and I that really resonates, because at the very beginning of the pandemic, I mean, we talked about, and there were articles written about this idea of grief, and of, while you were making these tough decisions, every business across the city of Reno is making tough decisions, right? And every parent about school, and it's kind of like it all kind of all of a sudden our lives changed, and
minutes.
The world changed in minutes, right? And so your concern for your city really shows through. And I want to ask you, you initiated a really interesting program throughout the city focused on mental health. So I would love to hear what led you there to focus on that as kind of your core or as a key community health priority during the pandemic.
Right. Well, I have to say, it's kind of funny. You should know this. Like, I've always been very passionate about mental health for, many reasons. And most of them, honestly, are personal reasons, because, I lost 2 family members this year, and ultimately it was due to mental health challenges. And quite honestly, it was something in my family that, I never wanted to talk about publicly, because I did not want to shame my sister or my brother because of their mental health challenges. And, it was sort of this dark, dirty secret that we had in my family, but we also, I noticed it's the dark, dirty secret that we have in our country. And so I've always been a big advocate of mental health. And matter of fact, whenever I won my city council seat, I'll never forget, and many of you in policy will relate to this, but I went into our community director and I said, okay, what do we have on mental health and addiction? And they said, what are you doing at the city? We focus on sewers and streets. And I was like, what? They were like, that's at the county. You ran for the wrong office, right? And so that's another thing that I think we all learned, that, people sort of put them in jurisdictions. And I think the issue is so much larger than that we all have to be thinking about it regardless of jurisdiction, or if we're really going to make, an impact. But one of the things is that I obviously, dealing with a city during COVID, and then many cities like my city, we also had riots and unrest. And that was, incredibly stressful as well, because we're trying to get people not to, congregate in large groups, and, being very worried about the health and safety of your entire community, and on so many different levels. And then my sister, who's only a year older than me, she moved in with me during this time because she was dying of stage 4 breast cancer. And, I remember, watching everything unfold, and meanwhile taking care of her as she was dying. And to be honest with you, it's really sad because her death certificate says breast cancer, but I have to tell you that she really died of, massive depression and anxiety, and, a whole system that is incredibly broken. And then 6 weeks later, my brother died unexpectedly, and he died from a heart condition that, I think was ultimately from self-medicating because of his, bipolar disorder and anxiety and things like that. And so here I am, running a city, and I'm, falling apart emotionally as well, watching my siblings die. And I just, I honestly, Sarah, I was falling apart. And so I knew that I kind of needed to reach out and to get some, help for this, and talk to someone. And my experience was just, it was eye-opening, because when I reached out to providers in the community, they would say, oh, it's going to be, 6 to 8 weeks. And also, do you have health insurance? And I'm so blessed as a mayor that, of course, I have good health insurance. And they were telling me, you are going to have to self-pay. And I thought, wow, I can do that. But what about the rest of my community? And also, here I am really kind of needing to, speak to someone right away, because my grief was so overwhelming, because personally and professionally, everything around me was falling apart. And so I used this app that many of you might be familiar with, and it's called Talkspace. And I noticed that, was really beneficial for me, obviously on a crazy busy mayor schedule. It's also hard to kind of keep appointments, especially, as women, we all know that we sort of put our health on the back burner, right? Like, we're all familiar with that. And so when I reached out, to have a membership with Talkspace, it was really great because it was so accessible, and it was something at the time that, I could have at my fingertips. And I never thought that I would use, an app to that capacity. I think I come from a generation where I really want to see you in person, and so forth. But I realized, and I didn't use it for long, but because mine was so situational depression, right? Where, when it comes to mental health, there's other types of chemical depression and things like that, right? But for me, it was incredibly, incredibly beneficial. But after I had used it, I had thought, how can this possibly be in a city that we have such barriers to mental health? And this obviously was something that I had dealt with for years and years, watching my brother and sister struggle with mental health and addiction. And so I had kept thinking, we've got to think outside the box. There's got to be some way we can offer better access to mental health services. And I actually was sitting right there, and this commercial came on with Michael Phelps. Many of you have probably seen it with Talkspace. And then also Demi Lovato, she popped on. And I thought to myself, wait a minute, what if we could possibly provide Talkspace to an entire city? And I thought, okay, Hillary, everyone's going to think you're crazy, but I am sort of that mayor. Like, I never think anything is off the table. I think you always have to be pushing yourself and having, bigger ideas, even if they fail. It's when you stop trying is when you fail. So I kind of have that, mentality. But I thought, oh my gosh, what if we really could use this service for everyone in our entire city to access. And so I called a friend because she knew someone at Talkspace, and she said, yeah, no problem. Let me, reach out. The next day we were literally on the phone with the Talkspace team, and they were like, wow, we've never done it for an entire city, but we would love to be able to help you in any way that we can. And I knew it was going to have a lot of pushback, and it did have a lot of pushback. I will tell you, my team at the city of Reno, they sort of know how I am and how I operate. And, they kind of like, they know that I don't take no for an answer. And when I told them, they said, yes, this is great, let's do it. And so we did. So we did this initiative with Talkspace where we offered free memberships for an entire year. And it's the full membership. And typically a membership will cost around $400 a month. And so, we launched it, but it was very controversial. I will tell you that, because the local therapists felt incredibly slighted. And, the interesting part is I started to work on an initiative, a mental health initiative. It's a 24/7 crisis center. And some of you might know it. There's Crisis Now out of Arizona. And if you don't, it's fantastic. I would tell everyone, please look into that model, because I started that model originally right before COVID. We were just sort of getting it going. And so I just started to reach out to our local therapists and our local psychiatrists and people in the community, but it hadn't, gotten to the point where it was ready to launch or initiate. So, and then COVID hit right away. So it was not well received with our therapists locally. But what I did learn is that many people that are using it in my community, especially our younger generation, and we are seeing very, very young, from children having some incredibly difficult mental health challenges. We've seen a lot of suicide in my community. I'm sure you've seen a lot of suicide all over, in all of your communities, right? And it's in these very young ages. And many of them have reached out and said, wow, Talkspace was incredible, because I, basically grew up on this, right? Like everyone grew up on this thing, and they were really, really receptive of it. And then I have to tell you, some of my police officers were telling me this was fantastic, because, I sort of always had this stigma where I felt like I could do this much more privately and I could do it on my time. And so we had, some incredibly positive responses, even though, our local therapists were incredibly unhappy. And I will tell you, the Talkspace model, any therapist can also sign up, and utilize their services. And I also felt like it was a great way for eventually that maybe my community would be receptive to seeking therapy and to talking about mental health. Mm-hmm. And so I really saw it as a long-term play to actually sort of be able to get my community to be receptive to the thought of therapy, because some people still equate it with big stigmas.
Yeah, thank you. Wow. I mean, first of all, I have so many thoughts and questions for you that are coming up with this. And thank you for sharing your story. I'm so sorry for your losses. And, I think we can certainly relate and certainly, so first of all, sorry for your losses.
Thank you.
Yeah. And, just kind of relating to that, needing to pull yourself together and lead, and, but wanting to put the pardon my dust while I pull myself together sign on the door. And you just can't
right.
do that. But as a leader, but for you to be so open with it, and it's interesting when you talk about the stigma, because I was just listening to a brand new podcast that has come out about cancer, and it's called The Cancer Mavericks, for those who are interested. And it's really about how cancer had sort of the same kind of stigma, attached to it. And, then people started speaking out and saying, well, this is something we have to talk about. And it's, it feels a little bit like mental health is starting to come out of that box, but that a lot of people still carry with them that stigma of this is something I shouldn't talk about, or I can't talk about, or it's like you said, it's like a dark, dirty secret, or, I'm a police officer, so I'm expected to show up a certain way, and, or I'm a man, I can't show up a certain way, what have you. So just, bravo to you for what I'm hearing you do, even, what you've already done is kind of to normalize it, right, and start to normalize that this is something that people are dealing with. And I want to ask you, you went right there with the sharing that there were some positive outcomes and that some hoped for outcomes. And then there was also some pushback. And so what I want to ask you is kind of, first of all, if you could share, go a little bit more into what the results have been. You mentioned a lot of young people have used this. You heard from the public safety community. In the year or so that this has now been ongoing, what are some of the tangible results that have occurred?
Yeah, so right now we have, I think it's 1,800 users right now. And I think if you really think about, if that helps someone avoid relapse, like we saw a ton of relapse. And so I received a letter from this man that said, hey, this really helped me from relapse. And then a lot of people could not afford to continue to go to their therapist. And so this honestly was another way for them to access, some type of healthcare in this capacity. And again, I think it was really beneficial, especially I saw with our police officers, because I think so many people don't realize that we have failed them on many, many levels when it comes to their mental health. I know, when trauma happens to them, we typically say, okay, take, 3 days off, and then we send them right back out there, right? Like, it's a real serious issue in our cities, and dismissing that, mental health is a big part of our public safety and our officers and keeping their wellness together, right? And so I've had several officers just say this is, something that has really been beneficial. And again, the stigma, especially with our officers, because we think of them, in this sort of strong, macho capacity, right? Again, that they're not allowed to break down. But I think the results, honestly, again, this is sort of like the intervention side. We were talking earlier about, the big topic for mayors in cities is homelessness. But I keep saying, yes, but we also need to stop with like step 10. We need to start with step 1. And that means, what were the circumstances that got people to that place? And we need to start thinking about, pre-Ks and early and often intervention when it comes to mental health and treatment. I would just say, start thinking about how you can implement like SEL in schools, social emotional learning in schools. I think those kinds of initiatives are incredibly important. And if you are like me and you are a mayor that doesn't have the health department in your purview, like we are not the health and human services side, or if you're a policymaker, there's no reason that you can't start a board on mental health and get people to the table out there that, are experts and understand the complexities. But I think that, we are going to have a really challenging time addressing, our homeless issues if we don't start thinking about how we treat the root of the problem. And, one of the things I always talk about is, think about this. And I think we have all experienced this in some capacity, but I don't know if it really resonates. But think about it. If there's a man lying on the ground and he's screaming in pain, and what do? We go over there, we assess him. Okay, we find out that maybe, he had an appendix burst. We take him to the hospital, and he has surgery, and then he's well. Well, you have another man laying on the street screaming in pain. We assess him, and we find out that it's mental health issues like bipolar, schizophrenia, or things of that nature. And what do? We leave him lying on the ground. I mean, so I'm saying, like, what is wrong with this picture? And also, using jails as mental health hospitals has got to stop. And even our ERs are not equipped for it. But look at policy of thinking about, if someone is released from the hospital after, a crisis situation or some mental health issues, think about the policy of, can you put in something in your city or in your state about requiring, 30, 60 days of required, mental health treatment, things like that, and really sort of looking at it at a much more holistic level because I think, now we're in reaction mode instead of proaction. So I think we need to start thinking, what's the proactive piece? And again, like we were talking about Talkspace there were a lot of people that were unhappy with me, but I think the results, at the end of the day, I'd love to come back and share them with you. We're still, right in the middle of it, but we've had a lot of residents say, hey, this helped me on so many ways, from avoiding relapse, or, this, like I said, this young teenager that said, I felt like committing suicide. And so I think even if we've saved one person's life, it's been well worth it. I mean, a lot of people thought it was incredibly expensive at 1.3 million, but quite honestly, I think that's a very small price to pay when it comes to saving people's lives and offering access to healthcare. Because honestly, we have really have a massive issue across our entire country, and not just our cities. But I hope that all of you that work at the local level realize that you can make really big change. And especially today, just like talking about it, Sarah, you hit the nail on the head. We're not talking about it enough. And I never wanted to, because I didn't want to shame my brother and my sister. But now that they're gone, I can't change it for them, but I can certainly change it for someone else in my community. So if I stand by and do nothing about mental health, then I think, I think that's completely negligent of me as a leader in our community.
Wow, that's a really strong statement. And it clearly, I mean, you're thinking about mental health as being so integrated with all of these pieces, like, talking about homelessness, about public safety, about the young people, about the schools. And I can tell you, as a parent of two teenagers, my husband is a teacher himself, and kind of cares for, in many ways, elementary school students. It's really there and present. I want to get into some of the operations and the logistics, because first of all, I mean, the things that you're sharing and talking about are you talked about being reactive and instead of proactive, and how kind of just nationally we've been probably way too reactive on this. And you took the opportunity to leverage some resources and bring this forward, but kind of mention, I want to return to those local therapists, because what's interesting is that it's like there's sort of this new paradigm emerging, right, for mental health and mental health treatment. But the existing paradigm of like go in person, and maybe you can use your insurance, but probably you can't, and that's certainly there's a lot to get into. There are a lot of policy issues to get into there, but I'm curious, just from your local perspective, like, how have those conversations gone? What if anything, has anything been sort of resolved, or what kind of progress has been made in those conversations, in terms of like getting everyone on the same team of, of course therapists are there because they care about mental health, otherwise they wouldn't be there,
Right.
but this new and very, there's a big market out there, right, for venture capital and for sort of digital talk therapy, and that's not going away no matter what you do. So I'm curious what if anything has come of that over the past year.
Yeah. Well, as uncomfortable was it, as it was going through that and having, a lot of our therapists upset with me, it actually was really beneficial. And I'll tell you why, because it really opened up the conversation and the dialogue that I have never seen, from that side of, sort of my community. They were all reaching out, hey, I think there's a better way, and then also kind of looking at what infrastructure they could build. Because I also did another set aside of $1 million that I wanted to use locally. And so many of them came to the table and had fantastic ideas. And I did have to really explain to them that unfortunately in government, technology is incredibly antiquated, and it's not something that we could have honestly feasibly set up ourselves. It would have cost millions and millions of dollars probably to set up that kind of technology and infrastructure, even for at a local level. And then not to mention, you've seen how sometimes when the government does that it's not very effective. There's some things that we do well and some things we don't do well, and we shouldn't be doing those things. So partner with those people that do them well. right, is kind of always been my motto. But it was great because honestly, I started to meet with them regularly on Zooms. And like I said, I'm putting together this crisis facility that will be open 24/7 in my city, because I don't want people, like I was talking earlier, I don't want people to be, treated for mental health in our jails. I want a place that is open 24/7 in my city, where everyone, every provider, I don't care what it is that you provide in the mental health space or in treatment space, or if you are a nonprofit, or if you are a for-profit hospital, that everything sort of exists under one roof. And my governor was incredibly generous and gave me an incredible building to do this facility out of, on a pretty large campus. And so, and I'm sure all of you know, one of the challenging pieces when we're trying to bring initiatives together or policy together is everything seems to be so siloed. Everyone sort of works over here and over there, and no one is in one place. And I think that's incredibly frustrating. So this initiative will have every therapist, if they want to be a part of it, every, nonprofit, every provider, like I said, hospital, everyone will be invited to be at the table to service our entire community. And, look at ways in which we can do a much better job when people are in crisis, or if they're homeless, or, I mean, just think about it. When now we have our police officers going on so many mental health calls, and it just can't be like that. And I just cringe whenever, someone is arrested for mental health reasons. And so this facility would be a place where our public safety can come and bring them, instead of taking them to hospitals or to our jails, because it's not appropriate. But it's what they call a living room model. And again, I hope everyone looks into it. It's crisisnow.org. And again, it's much more proactive. It's a proactive approach. And I think if we start to use these approaches in cities and really get everyone who is in the space, from our therapists, our psychiatrists, that are working in mental health and addiction, that we will be so much better off, because we can offer them in one place. Now, not everyone in the community is trying to figure out, well, where do I get this resource, or where do I find that resource? Or, I'm clearly, having a crisis at this moment. Like when you call the crisis hotline, like for some people that might be helpful. I did it as an experiment to see, what kind of, sort of experience that I would have with it. And I thought it was really challenging. So I want one place in the community that my, entire city knows that this is where you go if you need mental health help, and get caseworkers, right? So we can follow, when people need to be taking medication. And that's a big part of it. I've learned so much from my brother and sister, that they would be doing really well on medication, and then all of a sudden they would, stop taking their medication. And so there's just so many different facets to, why the system is broken. But in my city now, I've brought everyone together, and we will open, that center. And I'm trying to get the other jurisdictions on board. Everyone seems to, be very positive and enthusiastic, but we all know that, sometimes politics comes into play. But I'm very optimistic, and it's something that I want to see in my city, that everyone knows if you're having, mental health, there is a place for you to go. And then we can refer it out and keep caseworkers on it. Or if they're just released from ERs, that there is a place that they can go for, how many days that they can seek mental health services. Because so many times we let people out of the ERs with no help, and they're still, yeah, they're still really in crisis.
They're still in crisis. Yeah. And, it's a lot of what you're talking about. It's like this idea of like right place, right time, right moment, the right help at the right time in the right place. And it sounds like what some of you're talking about is place-based. And then of course with the digital therapy, that sort of met a different set of needs. I'm curious, like how you think about, you've mentioned homeless individuals, children, adolescents, different kinds of people who've used the service. And I'm wondering, one of the things we've spent a lot of time thinking about and talking about the Alliance has been this idea of like digital equity, or like tequity, and how do you make sure that people who maybe, aren't like using
Right.
phones or have like all the data on their phone or something like that, that's something that they can access. Is
Yeah.
how is that something that you've thought about and considered addressing?
Yeah, I'm glad you brought that up because that is a very big issue. We certainly saw it with COVID related issues with our senior population. I mean, even
Mm.
just to get them vaccines, I remember calling some on the phone and saying, "Hey, I can get you in for a vaccine." And they literally thought people were just going to, call them up, right? Like a lot of our senior population, did not have access to technology at all, or we're super uncomfortable with it. And we still live in a society that many people do not have access to technology. So I'm so glad that you brought that up because there are a lot of inequalities in communities because of that lack of technology. I'm proud that with our CARES Act money, we bought a lot of, laptop computers, but I was sort of laughing. It's, with some of my council members saying, but you guys, you have to make sure that they have access. They can have a laptop all day long, but if they don't have connectivity. And so we were reaching out to our connectivity providers because there are still so many people that don't have access. And again, our senior populations, right? And our seniors
Mhm.
have very high rates of suicide. And that's why I literally was reaching out to them by phone. And I got to tell you, there were so many times that I wanted to start crying when they would be like crying and saying, "Oh my gosh, I've been so scared this entire year. I want the vaccine so badly." And whenever you tell them, "Hey, I got you an appointment because I'm on the board of our housing authority. So I have access to so many seniors that are living in public housing that need technology and help, and we
Mm.
provide that at the housing authority, but it's still very difficult with our senior population because they're not comfortable with using it or even understanding it. And so that's why I think there are going to be two shifts, and that is the tech side of things where people know how to access it and use it. And I do think that's important for our public libraries to continue to keep that accessibility. I think that is really important. And then on the other side of it, you do have facilities that need to be in person, because I think it's just very different on what is probably best for you. Because with the teenagers, many of them said, "I would never go to therapy, I would never feel comfortable with that." But this is the world we're
Mm.
living in, so we need to look at ways in which we adapt that are different, whether it's in person or the technology piece or community outreach. Community outreach was massive for my senior population. So you've got to be thinking about the ways in which different populations and communities will react and be able to access. That's really important. We even used a lot of our faith-based communities to help us spread
Mm.
information about mental health initiatives and about vaccines. And so I think you've got to start thinking much bigger and broader.
Yeah, thank you. And I'm glad you brought up the seniors and the older adult population, because that's often, one that gets
Mhm.
kind of forgotten when it comes to mental health challenges. But obviously, social isolation has been a very real challenge, especially for them. And there's lots of data that social isolation, especially in senior populations, it's a real health risk. So I'm glad you brought that up. And thinking about the need to meet different needs in the community. There's definitely no one size fits all.
No, that's very, very true. But I think,
Yeah.
I mean, look at the Talkspace was so not traditional. And we started, and I hope everyone goes and looks at it, but we started something called hopefulcities.org, hopefulcities.org. And in that initiative, we also, I partnered with Catherine Getsky. She's from the iFred Foundation, and she does a lot of study on hope and
Hmm.
hopelessness. We know hopelessness is a massive driver of depression and suicide. And so she does really big initiatives on hope. And so we started something called hopefulcities.org. And please check it out because there are a ton of free workbooks on the study of hope. She's worked with he's a child psychologist and psychiatrist from Harvard, and she has many people on our board that are experts in the study of hope. And we wanted to use that curriculum to be like the first hopeful city, but also use that curriculum for the people that couldn't access Talkspace, or maybe our younger generations, like our pre-Ks, and our teachers. And so there's workbooks for teachers to learn about the study of hope and to teach, their classrooms about hope and why it's so important. And, we think about hope. I thought it was really interesting because you talked about it like this. We need to start thinking about hope like it's a muscle, because right now we think of hope as a wish, right? We've got to stop thinking about hope as like, oh, I hope I get to do that someday, right? So we talk about hope like it's a wish, but we need to talk about hope that it's something that we can grow and something we can expand on and use it sort of as a muscle, right? And so check out hopefulcities.org. We hope it's something that other cities will adopt, and we're calling ourselves the first hopeful city. But it's a great way, for many of you to have access to those materials for free. So reach out, and that's also where we have the Talkspace hub. And so we've been sort of pushing that out in my community to let everyone know that we are a hopeful city.
Wow, that's great. Thank you. We will check that out. And I want to encourage the audience to ask questions now in the chat box, and we'll start to cover those questions over the next 10, 15 minutes or so as we this is a fascinating conversation. I feel like I want to come out and spend a weekend and like learn all about everything you've been doing. Is that okay? Can I invite myself over now that we're allowed to fly again?
Yes, of course, anytime, all of you.
That would be really great. So the first hopeful city. Okay, I want to keep talking about hope, but while we're getting audience questions in, I want to ask you about like dollars and cents and operations and technology and infrastructure, because that is the stuff that that like drives all of this and makes it possible. So I want to ask you just from for our federal, largely federal and some state policymaker audience, for folks who are listening, can you just talk about again, like how did you leverage these federal dollars? You used your CARES Act funding. Can you just like walk us through maybe some of the mechanics? And what are some ways that you're hopeful that like federal and then state policy can support these kinds of efforts to expand mental health care in the future?
Yeah, well, I'm sure many of you realize the CARES Act money was really challenging because there were, stipulations on it, but there were deadlines on it. Honestly, I felt like I was like on some crazy game show to spend this money, like, at this certain date. And it was, and that was another thing that was so incredibly stressful. And I think many mayors felt a lot of anxiety because, you almost on the fly, you're trying to figure out, okay, where do we spend this money? And, for me, it was always like, for our economy, I'm a small business owner. And our small businesses are the lifeblood of job creation. They create more jobs than big business and Fortune 500 companies. It's our small businesses, and they were the hardest hit. So for me, it was keeping our small businesses open as much as possible so people could keep their jobs, right? Because we know that also goes hand in hand when it comes to poverty and those things. So like this sort of crazy time of how do we spend this money. So for me, that was a big part of it. Food insecurity was a big part of it. My council was incredibly thoughtful, but I knew right away, I was just, so committed to mental health because I knew what I was experiencing. And if I'm experiencing that, again, I'm the mayor and I have tons of resources at my fingertips. So the CARES Act money, honestly, was incredibly beneficial. And again, we used $1.3 million of that CARES Act money to fund this initiative. And I'm sure you can only imagine, the outcry that people had and said, wow, that's, incredibly bold, or, we can't believe you're doing this. But I also just felt like there are so many ways in which, I think government wastes money that we can do such a better job. When we really pay attention to those initiatives, again, partnering with people has been so incredibly beneficial. Like I was saying, can you imagine if we built that infrastructure ourselves with technology? We never would have been able to do that. But I think, especially in my position, my body is such that I'm one vote, right? So I have to work with everyone, all my colleagues on my council, and I have to, be very thoughtful about the things that I, want to approach them with, and vice versa, and really working. For me, I have to really work with my body to make sure that, we're getting things done and that they're incredibly thoughtful. I was very proud of the city of Reno because everything was really humanitarian based. I thought that was really important. We really, really focused on people first. But there were times where I was like, well, wait a minute. Like I was talking to you about the technology. Yeah, that's great that we can give all these schools laptops, but how many of these children actually have connectivity, right? So you have to
Right.
think about which that sounds great that we're going to give you computers, but think about oh, wait a minute, they might not have connectivity, right? So like
Yeah.
government does a lot of things like that, and you have to be very careful, right?
You have to connect the dots, and it's true with when we talk about that digital divide. It's you might have the connectivity, or you don't think that maybe like I know in my county where we talked about there's one family using the one laptop, or they have
Yeah.
to use it at different times of day. The siblings have to share it, and there's disparities. We do have an audience question, which was whether you or in the results so far, if you've noticed any racial disparities in access to Talkspace, or economic disparities in access to Talkspace so far.
So far, I haven't seen any, and it's certainly been a big topic of conversation, especially with COVID, right? Because we know that there are certain populations, especially our Black and Brown communities, that really have been affected, like on so many levels, right? So every time, that's another thing, is like really looking at the accessibility for our populations that have a much more difficult time when it comes to whether it's experiencing poverty and those things. And that's I would say that's one really good thing. I think there's some good things that have come out of COVID, right? And that's one of them, about talking about the inequalities and throughout our city, that it's really forced people to have those tough conversations that I think are really, really critical. I haven't seen any barriers, in that capacity to Talkspace. But, I think it's certainly something you have to think on every capacity, whether it's Talkspace or other initiatives. What are those barriers? Again, like we really did a lot of outreach, on the ground level when it came to getting people testing, right? Because they didn't have access to technology, because the poverty level or whatever it was, or even English speaking, right? Like there were many people that didn't even speak English, so we really had to like kind of do a grassroots initiative to get on the ground and get our community to know that we had certain services
Mhm.
available. But I do think that's one thing that's been really good about COVID, is addressing the our populations that get overlooked.
Yeah, thank you. That's so helpful. And it's hard to believe we're starting to near the end of our time. So I want to focus our next few questions on like what comes next. I mean, we've had you've had, I guess, a year or nearly a year of this. You mentioned like the CARES Act funding was expiring, so you had to spend it, and there was clearly this unmet need in your community. You've talked about the 24/7 crisis center. What happens next? I mean, when the membership expires for these people, or is that it? How are you thinking about sustainability moving forward? Are there other digital
Right.
therapy providers out there that you want to think about?
Right.
Talk about like what are you thinking about coming next?
Yeah, I think that's a great question. I think too, what everyone should know a little bit about my city is that financially, Reno was not in a good space. We were $600 million in debt whenever I got there, and we paid it down by 200 million. But many of you that are in cities or counties that have challenges, financially, you're always trying to like figure out, where are we going to get this money to sort of sustain these types of initiatives, right? Like that's always in my city is always something that we just struggle with. And I think most cities are like that, right? And so actually, for us, and we've talked about this, when the Talkspace initiative runs out, is doing a deep dive and seeing how many people are using it, connecting with them, and saying, hey, is this something you want to continue to use, and look at grants? Because one of the things that I did is I got really aggressive with the opioid companies, and we, we sued them, and we're finally starting to, see some awards from that lawsuit. And so I would like to take that money and be able to put it into mental health and continue, a Talkspace initiative. If, my citizens really feel like this is something that they, really, really need, or, start to get them into local therapists, because maybe that would be more helpful, or, just better mental health initiatives. So for me, I'm really going to focus on using some of that opioid lawsuit money, because with that whole situation, that comes down to mental health too, with, the opioid crisis, and how it just stressed out our public safety, team to no end, and how really cities were the ones kind of left with, hey, what do we do about this crisis? And how do we get people treatment? And what do we do from here? So for me, that's sort of the direction that I'm going to go in, and really use sort of that pot of money to be able to continue, some mental health initiatives.
Yeah, thank you. And I mean, we were talking about, pre-pandemic, right? This idea of these deaths of despair. And, you've mentioned suicide a number of times. You've mentioned, like the opioid epidemic. And it's certainly, to my understanding, that part of it hasn't gotten any better either. And so it's kind of like a mental health crisis layered on top of an existing mental health crisis, right? So there's a lot we could do. Do you think the mayors are going to come up with some like shared priorities that they're going to be advocating for?
Well, I'm glad you mentioned that. So I was well, I can't announce it yet, but I'm working on a very big initiative with mayors across the country. I'm very involved with the Conference of Mayors, and I think, again, it's something that every mayor has to be talking about. Like, honestly, hashtag mental health first. Again, if you think about, if we started to pay attention to mental health in our cities and made that the first priority, I think we would be so much better and healthier as communities, right? Economically and, physically and mentally. And it's so funny in our world how we focus on our bodies and we go to the gym and all those things. But what about our mental health piece of it, right? Like, it gets completely dismissed. And so, I really want mayors to start thinking about mental health and, the effects, and just think about it. Like we talked about America in Mourning, like how many people are grieving from whether they lost a family member, from COVID, or even just in my family, losing my brother and sister. We could not memorialize them, normally, or even it was very hard to bring in nurses, because, having sort of that help of when someone's dying was, there was no resources really out there during COVID, and just the loss of any family member, or just even the loss in business, right? There were many businesses that closed. And so I think it's a year full of loss and grief. And I think, mayors across the country, really, that's what I'm going to push for next, is to really make sure that it's a nationwide initiative in cities with mayors, is really where I see it. We also have some great mayors that work on, these initiatives. And then there's Charlene McCrae, who is Bill de Blasio's wife from, New York. She works, heavily in mental health space. But again, I think sometimes it gets a little siloed, and we all have to do it together. So I hope that that's where I can be effective, is with mayors across the country, so it affects all of your cities. And what I would say is, government does not have all the answers, Sarah. We know that. Some of our best solutions and initiatives come from all of you guys. So reach out to your mayors, because as a mayor, I love it when my community says, hey, Hillary, I've got this great idea. And many of those ideas are something that we can implement, but we're not thinking about them all the time. And especially mayors, because they've got a pretty big, full plate of other initiatives going on. But so I would just say, please reach out to them, and also tell them, hey, Mayor Schieve from Reno told me to call you and reach out. So go right ahead.
All right, Mayor Schieve sent me. And this is a great, so speaking of being accessible, so how do they do that?
Oh, you cut out, Sarah. Uh-oh, you froze.
I I froze. Oh no. Can you hear me now?
Yeah, I can. What was the question?
Okay, my question was, since I'm now going to call my, well, I don't have a mayor, I have a county executive, but how do they reach you? How do they reach out? How does anyone like find out who their mayor is?
Oh, well, just go ahead and Google it. That's probably like the best.
Google.
Or I don't know about your city, but we have
Yeah.
City Hall where we have the public come in every Wednesday, and I'm very accessible. Except for I'm not on Facebook anymore. I always laugh. I got 8 hours of my life back every week on Facebook, and
There you go.
joking to my girlfriends. I said, "Wow, I never knew how fat, ugly, and stupid I was till I got on Facebook." so,
There you go.
Don't recommend that to reach out to your mayor on social media. I mean, I do use
No.
Twitter because I mean, how much trouble can you get in 180 characters, right? But I would say just Google them, and then they should all have city addresses or county addresses. And if you're having a really hard time, you can reach out to my office, and we will connect you with your mayor or your county commissioner or whoever that is.
That's great. That's great. Well, let me ask you, just one last one, which is, I'm curious if you think that do you see the culture of your community changing after this? Like you've expressed such concern for your community across. I'm curious what you think their feedback will be.
Well, I think too, if you're a politician in today's era, it doesn't matter what you do, it's going to be wrong. So you have to be really convicted, right? I mean, again, that's why I'm probably not on Facebook, but I think you have to stay really, really convicted. It's something, mental health to me is something that I'm so passionate about that, I'm not going to give up. Or, I always say, turn your haters into elevators. Be better, not bitter. And so I hope that, some people are very receptive. And like I said, if it saves one life in my community, then I think it was well worth it. Because if I could have done that for my sister and brother, there wasn't any amount of money that I wouldn't pay to do that.
Thank you. Thank you. And we will be exercising that hope muscle as you encourage us to do. Yeah, thank you so much, Mayor Hillary Schieve of Reno, Nevada. It has been an honor and a really enlightening hour with you. And I certainly hope our conversation continues. And when you're ready to make that big announcement with the mayors, we love to stay in touch on that as well. So thank you. And many blessings to you and your family and your community.
Well, Sarah, thank you so much. And thank you from the bottom of my heart for the Alliance for Health Policy. Honestly, it gives me a lot of hope, especially with, your organization talking about it and bring it to the forefront. Like I said, we've got to stop the stigma. We've got to quit shaming people for it. But so I want to just thank you all from the bottom of my heart, and keep up with great policy, and don't take no for an answer. And like I said, be, better, not bitter. And Sarah, come out anytime. We got Burning Man in my backyard. So if you've never been to Burning Man, it's quite it's an amazing, event to see. So you're always invited to come out to Reno anytime any of you are invited. We'd love to have you. I think you'd like what we've done with the place too.
That is awesome. I cannot wait. I cannot say I've been there, so I will look for. We've been to Lake Tahoe, but not to Reno. So I'm really looking forward to that day. And thank you again. And to you, our Alliance audience, thank you for joining us. We have a feedback form if you want to fill out a quick survey. We really use it. And we really we work to be better, not bitter. I'm gonna keep saying that. That's fantastic. So please do fill out the survey. A recording of this webinar will be available, and we look forward to really following up on many of these themes, including mental health and homelessness. I will say, not quite ready to announce it, but there will be some specific programming on homelessness later this year. So please stay in touch. You all are our virtual community, and we can't wait to see you guys again in person. Thanks again. This concludes our summit on health and the economy. I've been here with Mayor Hillary Schieve for this hour, and we thank you, and we'll see you guys again soon. Take care.